This episode of Common Health is brought to you by Reg Lantern. Reg Lantern is a straightforward and easily understandable software platform built to assist community health centers in staying compliant so they can focus on serving their patients rather than paperwork. For health centers that are serious about achieving, managing, and maintaining compliance, Reg Lantern provides a comprehensive approach and is an affordable and valuable solution. Reg Lantern can help your health center. Contact them today at reglantern.com. That's REG, as in regulations, lantern.com. For special discounts, mention that you heard about Reg Lantern on the Common Health podcast.
Hello, and welcome to Common Health from the Virginia Community Healthcare Association, or VCHA, or what we're also known as is VCHA. I'm Tracy Douglas, VCHA's Chief Executive Officer. On Common Health, we're amplifying the voices of community health, both those who give care and those who need it. And I always look forward to doing these shows and being able to provide you with information, lots of information, if you will, good information that comes out of the Commonwealth of Virginia. Because a lot of what we talk about, as you know, listeners, actually could be occurring in your respective areas as well. And that being said, we have a great show for you today. This show is actually being done during the month of February, which is Black History Month. And we wouldn't be doing credit by recognizing this month if we did not have an opportunity to speak to some of the great folks out there who are really making a difference, who are people of color, who are making a difference in our world and in the Commonwealth of Virginia. And we've got someone here today, listeners, Dr. Betty Bibbins, and she comes from the Eastern Shore of the Commonwealth of Virginia. And Dr. Bibbins, let me tell you, listeners, she has such a legacy. And I really felt it was important that we had an opportunity and to really hear from her and hear about her story, but then also hear how her story relates to so many individuals here in Virginia. Dr. Bibbins has served as the president on the board of directors of a community health center. And as you know, listeners, we here at Common Health, we support all community health centers, and especially the ones here in Virginia. And she serves on the board of directors of Eastern Shore Rural Health Systems, which is one of Virginia Community Healthcare Association's members. Dr. Bibbins grew up in Portsmouth, Virginia. In 1963, she actually made history, listeners, by becoming the first African-American student to attend her junior high school during desegregation. She received her BA in zoology from Connecticut College in 1973. She also serves as secretary of the Board of Visitors for Eastern Virginia Medical School in Norfolk, Virginia. Dr. Bibbins is also a planning committee member of the Black Alumni Engagement Committee, and she serves on the board of directors of Connecticut College. And we'll talk to you about all these different things that Dr. Bibbins does and how it relates to where she is today here in Virginia. And she's also a member of the Committee on Academic Affairs and Trustee Faculty Liaison Committee. Welcome, Betty, and thank you for joining us.
Thank you for having me, Tracy. This is an honor and a joy. Thank you.
Well, it's an honor and a joy, Dr. Bibbins, that you've agreed to do this. And, Dr. Bibbins, one of the things that I really found very interesting about your story is where you grew up and your community and your family, right? And Portsmouth, Virginia. Can you talk to us a little bit about your upbringing in Portsmouth?
I can honestly say that if it weren't for Portsmouth, I wouldn't be the woman I am today. And it took me to adulthood to totally comprehend growing up in the community of Portsmouth. And I have to say the community because when I was born and raised in Portsmouth, there was segregation.
Mm,
And desegregation began when I was going into the seventh grade. So that was about 12 years old. But
mm,
prior to that time, family, church, and community. This is a community that when you did something wrong, it wasn't just your parents getting you.
right.
Everybody in the community got back on you
Right.
just like they were your mama. And the people that I see, or I saw then, is just Aunt Bertha
Mm,
or Uncle Jim ended up being Bertha Edwards, the first black librarian
mm,
in the community, the only colored
mhm,
community library in the state. She was down the street from us.
mm,
The Dr. Jim Holly, Uncle Jim, he was a dentist who ended up being the first black council person for the city of Portsmouth. But
mm,
not only just working with people who did things like this, and this was routine, but at that time when they had meetings at homes, my parents were very active in civil
mm,
rights. My father was from New Brunswick, New Jersey. So to him, he came to Virginia to go to Virginia State University and met my mother there. My mother was from Portsmouth. So he gave up living in a totally integrated environment to come here, and it just not was not his cup of tea. It was not going to continue.
mm,
And there was a soul, that's the only way to put it, a soul of people, the community, who said things are not right and we're going to make it. We're not going to destroy anything. We're going to make it happen because we know it can happen. And so it
mhm,
was a way of life. My parents found an integrated kindergarten when I was
mm,
5 years old. Catholic schools started integration before the public schools, and it was
mm,
one Catholic school in Norfolk. So each day when I was 5 years old, my mother and also they took other members of the family and kids in the neighborhood to
mhm,
Norfolk to kindergarten to make
mm,
sure we got educated because my father had come from an environment where education was good, solid, and he saw what was going on and said, we're going to get the best education we can, but we're going to make changes too.
mm.
So Bed Lou, that was my name growing up. Betty Lou,
Oh.
Bed Lou hung out in the kitchen, and because that's where whenever they had meetings, you put your kid in the kitchen before they went to bed. And I listened to how they plan things, how they plan single shot voting for people who had never voted before. When we started voting in Portsmouth, they
Mm,
had to go out and plan how to encourage people to vote because in those days, even voting, you might have been semi taking your life in your hands. But
mm,
to encourage the African American community to go out and vote and then not vote for all 6 or 7 people that could be voted onto the city council, but just one, Jim Holly.
mm,
And that single shot voting got him onto the council and started a long career, a long, shall we say, very textured career, to put it mildly, because he
mm,
was a character. He was a larger than life type of person, and that's how he survived it. But
mm,
the community being self sufficient, we were not as impacted when some people might have lost jobs because they voted or because we spoke out. But we were so self sufficient and sealed off that we really, the word I can say, percolated integration, civil rights. And so growing up, it wasn't something different to do. It was what you did. Period. It was
mm,
part of life. To
mm,
hear the planning, they integrated the libraries by Jim Holly and Dr. Owens, just walking in and to the white only library and being escorted out. But that started people really pushing, and the next year they closed the colored library. Aunt Bertha went to the main library, and it became integrated. And so
wow.
it's things like that. That was just a way of life.
Mm.
And hearing national people like Martin Luther King really impacted us, but they were working long before Martin became a fixture in our home.
Mm.
This was the way of life we were going to live the best way we could and for everyone. And by working together as a community, we were going to improve community.
Mm.
And so that's just how life began for me. And it was just forge forward, go over, under, around, or through with a smile.
Mm-hmm.
And to this day, whenever I see anybody, almost I say hi. That was the way you had it, because
Mm.
you get. Why didn't you say hi to them? Get a little
Mm-hmm.
tap on the cheek or a little pat
Yep.
on the head
Yep.
if you weren't civil and said hello
Mm-hmm.
to everyone you saw on the street, because they
Mm.
were part of community.
So it sounds like, and I love what you said, they were just part of the community. And, when I look at our community health centers, Dr. Bibbins, that, our health centers are all about communities,
Hmm.
right? Right. And so, you know, can you talk a little bit about during the time when you were growing up? Many of our community health centers, we try and reach all people, right? No matter who they are, what they represent, and how they pay for their healthcare services. It's all about all people. What was it like during that time in Portsmouth and being able to access healthcare services for people of color?
Complex. In the
Mm,
beginning, there was very little access. Norfolk Community Hospital was the only hospital specifically for colored
mm-hmm,
people. Other hospitals had, they call them wards for people of color, but they were dirty. They were filthy. They were usually the oldest part of the hospital, but it would beat no care at all. But everyone who could would find their way to Norfolk Community Hospital. And
mm,
that's where we went for care. My mother had a major illness that Norfolk Community Hospital couldn't take care of, so she ended up going to another hospital I won't name that had a colored unit. It was also in Norfolk, because not all hospitals even saw people of color.
mm,
And the ward that she was in was D ward, and it was the one of the I would say one of the earliest parts of that hospital that had modernized by that time, and the it was dinky, but
mm,
at least there was availability of care. And we won't talk about quality of care, but again, any care is better than nothing.
mm-hmm,
And that exposed me to the need for care. And my father was a dentist, and as many
mm,
patients paid as not. If anyone showed up, he said he knew as soon as a lot walked in the door that they were not going to, they didn't have resources to pay, but he was not going to turn them away. And none of the black providers of care in Portsmouth would turn anybody away.
mm,
Just that was the way it is. We took care of each other.
mm,
And if we needed hospitalization, again, North Community Hospital was there, a couple of others, one other in particular, but they were all Norfolk. And so community health centers, when they started evolving, I was in college when they really started here. I married the Eastern Shore. My husband was born and raised here. That's how we ended up here when we
mm,
retired. But during medical school, I had come over here and there was little available, even less here on the Eastern Shore. They had the hospital here that had, again, the colored unit, but you saw how little care um, people received compared to others. I'm not going to say no care,
right.
but resources were sparsely used. And that piqued my interest. So during medical school, I actually applied for and got a fellowship to come and spend 3 months finding out about health care. And they hadn't even started
Mm,
community health centers here on the Eastern Shore. The Catholic Church had a clinic here. And
mm,
unbeknownst to me, it was just starting in Accomack County,
mm,
and which is the next county up from Northampton, where I am now. And so, parallel with the nuns providing the care in Northampton County and community health centers starting, I found out later, in Accomack County. They then merged and eventually has become what rural Eastern Shore Rural Health is today. And
Mm.
I've run into a physician who was on the board with me when he was in Accomack, when I was in Northampton doing my project, working through migrant care, just seeing what care was available. Because again, here on the Eastern Shore was only one physician of color, Dr. Allen, and he provided care for everybody. And
Mm.
they had one midwife who delivered babies for everybody of
Really?
color. Yeah. And that was it.
Really?
But that was my exposure to basic care, and it really piqued my interest.
Mm.
And uh, that's why even before then, I'd had no problem signing up for National Health Service Corps. That put me through medical school
Mm.
because then I knew I would be at a community health center. And to me, that was a big plus as to see what good care could be provided and to know and knowing that I would fight for what I felt needed to be improved if I ended up being assigned somewhere that
Mhm.
didn't have resources that others might have had.
And
Because, yeah.
it's interesting, Dr. Bibbins. Can you just explain to our viewers about Eastern Shore? Because a lot of times, even though we've brought you here, you're a woman of color, you're a provider, a retired provider. When I talk to people, I always sit there and say to them, we provide care again, no matter who you are, right? And it's a diverse group of individuals, and we truly are about inclusion, right?
Mhm.
And I say that to say because rural is so um, the rural healthcare services is in such we are in such dire need to be able to service our rural areas. And you talked about, right,
Mhm.
what the availability was during that time, right, when you were
Mhm.
younger for people of color. But it wasn't even just really about people of color. It was just so can you just explain to the viewers, talk a little bit about Eastern Shore?
Eastern Shore is a beautiful world unto itself. Because we have, they say, three-fourths is really like four-fifths of the Eastern Shore is surrounded by water, and so we're self-contained. Healthcare, even to everyone, healthcare has been limited just because of location. And few physicians would come here. Most of the physicians that have come here because of someone who that was married, they married, or they're from here. And even 20, 30, 40 years ago, there were just a couple of providers, like of different areas, like internal medicine, family practice, or one surgeon type of thing. It was still providing just the most basic of care.
Mm.
Again, anything beats nothing, but it's sure nice to have more. And the community health centers provided the greatest amount of basic primary care, not only within the facilities but outreach, and that's what's just as strong as seeing patients in our facilities are the outreach program, especially to migrant workers. Not everybody has transportation, even though we're really spread out. So in rural America, you not only have challenges of quality of care, just basic primary care, but challenges of patients getting to that care
Mm-hmm.
when there are a lot of people. When I think of my husband's family, they talk about how they had to walk everywhere. They didn't even
Mm.
have cars. They had horses that pull wagons, but they didn't go long distances with that. You'd get a ride with someone when you could, but they talk more about walking places. And to a degree, you will see a lot of people walking miles on these roads to get just to a bus stop
Yep.
that goes up and down 13. And they do have some buses that come to homes if you have disabilities, etc. But a lot of people walk 1 or 2 miles just to get to the bus to go out to get food once a week or once a month or
Mm-hmm.
to get wherever they need to get. So community health centers have outstanding, they provide the services of outpatient care as well as outreach. And what is so beautiful that I love about, especially about here on Eastern Shore, we are able to do a step more because of the uh, success due to the input and the commitment of the community. This is what's a beautiful thing over here also, community
Mm-hmm.
towards Eastern Shore Rural Health. We are expanding to the point where we not only provide primary medical care, but we have dentists. We have some dental care that provides basic, and some it's starting to evolve into other areas of dentistry. We have behavioral science, and we have pharmacies, and we provide x-rays on site.
Yep.
And they're not read on site, but we do them and then they're read by radiologists away from us here. But long story short, we're able to provide appropriate and quality care to those who, from the whole spectrum, migrants, we go into the fields to see who needs what. We make sure they find a way. If they need to come into us, we either provide transportation or vouchers so they can get transportation to come to the health centers. We provide care for the total family. If there's a need for food, if there's a need for housing, we know how to direct them to where they can get support.
And
And yeah.
and I'm sorry, Dr. Bibbins, but you talk about all these things that community health centers do. And one of the things, listeners, I don't want you to confuse
Mm-hmm.
or get confused about with community health centers
Mm-hmm.
is Dr. Bibbins is a medical doctor that worked in a community health center.
Mm-hmm.
And I want people to understand that community health centers employ credentialed providers who are educated in our medical schools, right?
Mm-hmm.
Who have done research projects. And so, that being said, Dr. Bibbins, what if you could just speak a little bit to what I know you had a very humbled upbringing, and you talked about why you did what you did and why you got into the medical field. But can you just elaborate a little bit more why it's so important for those who are in medical school to think about coming into a community like Eastern Shore
That's
and working
mhm.
at a community health center?
It's where you're really providing care that is needed. There's areas where the only words I can say are medicine has become a business, and you're in it for the business of seeing people, but it's almost like a mill in
Mm-hmm.
some areas because you don't take into account the getting to know your patient. You just how many patients you can see a day.
Mm-hmm.
Here, you get to know your patients, your families. You provide care. You practice the type of medicine you went to medical school for. You practice the type of nursing you went to nursing school for. You do labs for patients who really need the care. And again, it goes back to sense of community.
Mm-hmm.
A number of the providers here are again either from the southeast area or they're married to someone from around here or they're again National Health Service Corps. Some stay, some don't, but I have talked to a number of the providers, even those that leave still leave because of some other reasons such as family or being pulled for some other reason, but they have such a feeling of fulfillment. That
Mm-hmm.
is the main thing in working with community health centers. You know you're providing a service that's needed and you get a chance to know your patients and you know you're providing care where it's needed, when it's needed. You get to know your patients. And
Mm-hmm.
that is something that I really feel community health centers will never forget. We will never make our patients a number because we have to go to them just as much as they have to come to us. And That's okay. Whatever the needs are, we at least have a finger on how we can provide additional services as needed. And we have referral systems in Norfolk and Virginia Beach and other areas, and even up north into Maryland as needed. And we get them in when additional care is needed, more so than what we can provide. So, rural health, Eastern Shore Rural Health provides care for between 65 to 70% of everyone on the Eastern Shore, from migrant workers that are seasonal to visitors that come in for the summertime to people that live here all year long. We're here and we will continue to be here. And it's a major balance. Again, it's not inexpensive, but we will always find a way. And with the support of the community, which is significant, they appreciate community Eastern Shore Rural Health being here in the community health centers, and we are here. We have multiple centers up and down the entirety of the Eastern Shore, and we're continuing to grow as the needs grow. And it makes
Yeah,
me feel so proud to be a part of this,
great.
because I'm doing what I feel and I see others doing what everyone feels needs to be done. And if we have to change course, we have to do whatever we need to do, but never forget the human factor in all this.
So, how do you talked about um, you, some of the issues that your husband, uh, uh, you know, endured when he was growing up in the Eastern Shore.
Mhm.
And, we all hear what's going on in the news. And, one of the things I'm finding, Dr. Bibbins, as I talk to more and more young people who are getting into medicine, they have this social justice piece to them now, when you start
Mhm.
talking to these young folks, right?
Mhm.
You know, what is it that's happening on Eastern Shore that you could say to a young resident who's considering, right,
Mhm.
on where to plant themselves? What could you say to them today that could draw them to the Eastern Shore so that not only are they feeling like they're meeting their desire and commitment to wanting to practice medicine, but also feeling like they're making a contribution to
Mhm.
doing what's right for their community, right? What is it
Mhm.
that you would say to these young residents out there?
We just want to get them here for a rotation, and it will be self-explanatory. Quality of life. They will see a quality of life that so many people are not seeing in cities and urban areas, and that's why we're having a major influx of people from other areas. And they will see again fulfillment in providing care where it's really needed. And even in areas of specialties and subspecialties, the needs are here.
Mm,
And again, this fulfillment, quality of care, quality of life. And that is so evident because of so many people who are influxing into this area now from urban areas to come here to live with remote and virtual workspaces now. People from other areas are almost taking over Eastern
really?
Shore. Yes, we
Mm,
have significant areas where, well, we have to say if they're not from here,
right, right.
are taking over. And that's a plus. It's adding a diversity, cultural, um, ethnic, just total diversity. And it's beautiful, honestly. We're becoming a real United Nations, a
Mm,
diverse environment. And that's adding to the culture of the Eastern Shore that's already here.
mm,
So for those who may not be from the Eastern Shore, I would encourage you, if you're in medical school or you just want to come here to do like a rotation, or come here to just visit us to see how we provide high quality care in the facilities we have all up and down the Eastern Shore, the top quality facilities we have that can compete and even beat facilities in larger cities.
Mm,
But it's a different pace, it's a different life. You live better and you know that you're providing for those who may have a lot or may have nothing, and it makes you fulfilled. And that's what I get when I talk to other providers of what they're getting out
mm.
of being here. Can't explain it with words sometimes.
Dr. Bibbins, what changes have you seen, better or worse, in the healthcare industry, more specifically in community healthcare since you began your career?
I've seen to a degree both, but the best thing that I've seen again is, I would say, the increase in outreach, where we make sure we're not missing anybody. We work
Mm.
hard at that. The other side is that, yeah, they're trying, governments and other agencies are trying to cut back. We understand about fiscal responsibility and fiduciary challenges and costs of everything going up. We have to look at sustainability because we have to be here for tomorrow, but we cannot forget humanity.
One of the things that, always strikes me and inspires me around individuals who get into community healthcare is their drive and their passion, right?
Mhm.
And so, what would you say to our listeners who aren't completely convinced on the roles that community health centers play in the betterment of our community, right? What could you say to our listeners who are not convinced that the work that's being done is work of value and that it does make a difference in the community as a whole?
I don't care to insult anybody, but we take care of all the people that nobody else wants to take care of. Community health centers catch the people that nobody sees that fall down and are maybe unable to get up on their own.
And it could be, and they
Yeah,
could have money or
they
they
can
could
have
not
money.
have money,
Yes,
right?
they can have money, they cannot have money. They're the ones that you don't see, the ones that can't make it to the clinics that people say, oh, they're lazy, they can't make it. But when you are sick, you don't have transportation, you have to walk long distances to get to something, to get you somewhere. We are the ones that say, can we help you? We don't force ourselves on anyone. We just say we are the ones who give a helping hand to those who need it. And a lot of people are proud. They don't want to ask for help. We're there for those who have nothing else. They can have the highest or largest bank account, but you see a lot of them committing suicide nowadays.
Mm-hmm.
So they need help from our behavioral health people, just somebody to talk to, just as much as someone who's working a field for 12 to 14 hours a day for pennies.
Mm-hmm.
They get paid under the table, pennies at a time, cash in hand, that gets them a sandwich and a soda or something to get them through till they can go and work another 12 to 14 hours the next day to
Right.
pay for food for them and their
Right.
family.
Right.
We take care of the ones, yes, that people see, but we were started and we continue to be there for the invisible,
Mm. And
those
you,
that no one see.
and you say that it's really profound, the work that community health centers
Mhm,
do. And when you say people that we don't see or that society doesn't see, and I interject by saying, it doesn't matter whether you have money or not, we see
mhm,
them all. And
mhm,
it reminds me of something that I read the other day, and I'm curious to hear what your thoughts are. Um, and I don't know if you heard the same thing, but one of our newer senators, um, one of congressional senators um, recently made the decision to check himself into a hospital for treating depression.
Hmm.
And Dr. Bibbins, to me, those are the people that we forget that we see in community health, right? That people don't understand. Those are the people that we see. This is a senator, a congressional senator that actually stepped forward and
Yep.
said, I need help.
Hmm.
I mean, isn't that kind of like the patients that we're seeing, you all are seeing, or you have seen in the community health centers?
You know something that is very, very that brings up a very beautiful point. When I have worked at other community health centers, my husband and I have traveled the country for our careers, and in some areas, community health centers provided the care that people didn't want to go to mainstream providers because they didn't want people to know they
Mm,
had problems,
wow.
such as psychological problems, sexually transmitted diseases, and things like that. And we saw people that could afford anything on the face of the earth coming to one particular center that I
Mm,
worked at, because so they wouldn't be found out. Uh, their challenges would not be known in the community. And so, again, we take care of the ones that, if what would they do if they didn't have us?
right.
We were there and they got care, whether they wanted to ever acknowledge it or not. So,
Mm,
we
yes.
see everybody and we don't turn anyone away and we are non-judgmental.
So, Dr. Bibbins, as we close out this show, I really feel I'd be remiss if I did not go back to your humble beginnings, given this month that we're in. And, by the way, listeners, even though we this month stands out as Black History Month, understand this is American history.
Mhm.
This is American history. And
Amen.
frankly, Dr. Bibbins, you're part of that American history. And, celebrating the achievements of you and other individuals of color in the healthcare arena. If you could just real quickly, can you just tell me and our listeners who has inspired you, who has influenced you in your lifetime, either of color or other?
Okay, community of Portsmouth. Parents really gave me a direction that nothing is impossible. You may have to step back sometimes, but you got to do what you got to do. Don't think twice about it, just do it. And whatever's meant to happen will happen.
Mm,
Um, getting a college uh, degree. Long story short, it was a very traumatic time in my life due to stressors, etc. Both my parents died when I was right if ending up high school, going to college, and the first black dean of Connecticut College kind of
mm,
took me under her wings, um, unseen, and provided me with education when other people were saying, "Let her go."
mm,
She's too much, too many problems, too many challenges, no money, to put it mildly. She gave me full scholarship and an education, psychological support to get over all the challenges going on, and showed me be there, the how other people can be there for
mm,
people, and you don't have to make a big deal of it. You just persevere. And along with my parents, she gave me one of the other strongest, Dean Jewel Plummer Cobb. She was a major, ended up going on into major cancer research. But she took time for a young lady of color going through multiple major life crises at a time. There was no income, no nothing, accepted me at Con, gave me full scholarship, took care of me psychologically, had me going through all this at one time, and never asked for anything in return,
Mm.
and just said, pass it on.
Interesting.
She became my community
Yeah.
and put me back together at a time when I was literally falling apart in life. So that is where community
Comes
still
from. Yep.
is strong.
Yep. Yep. And, listeners, I think Dr. Bibbins said it so eloquently, and around passing it on. I know Dr. Bibbins, you credit many, individuals in your life that have brought you to where you are today. And I too feel the same way about individuals in my life. And, listeners, that's some of the things that we do at community health centers is we only know how to pay it forward, right? Pay it forward. And so, listeners, if that's something that you're able to do, please take the time and be a part of your community.
And may I add?
Yes.
Sometimes it's just as simple as just saying hello to somebody you see on the street that you don't know. It doesn't have to be big. And it's just showing that you are giving of yourself in one way or another.
Yes.
And you'd be surprised the responses you get from people, especially when they don't expect someone to look them in the eye and say hi, and expect everybody to look away and turn away when you see a stranger on them.
And with that, we're just going to end it right there. Thank you, Dr. Bibbins, for your time. I want to thank my guests for joining us today. And thank you to all the listeners for tuning in to Common Health, brought to you by the Virginia Community Healthcare Association. If you enjoyed this episode and you'd like to help support Common Health, I encourage you to hit the subscribe button, share it with others on social media, leave a rating and review, or visit our website at www.vcha.org. This is Tracy Douglas. Thanks again, and I'll see you next time.